Welcome to Relax and Learn Medical, where we blend 432 Hz healing frequency music with engaging anatomy lessons to enhance your focus, memory, and inner calm. Today, we're exploring one of the most critical and complex systems in your body, the muscles of the back. From surface muscles that help you lift and move to deep stabilizers that keep your spine aligned, your back is a masterpiece of design and function. Whether you're a student, nurse, healthcare worker, or just curious about the body, this is your time to relax and learn. Let's begin. Superficial back muscles. These are located closest to the skin and primarily act on the shoulder girdle and upper limb. Trapezius, large triangular muscle that elevates, retracts, and rotates the scapula. Latissimus dorsi, broad muscle that extends, adducts, and medially rotates the arm. Levator scapulae, elevates the scapula and tilts its glenoid cavity downward. Rhomboid major, retracts the scapula and rotates it to depress the glenoid cavity. Rhomboid minor, works with rhomboid major to retract and stabilize the scapula. Intermediate back muscles. These are involved in respiration and assist with rib movement. Serratus posterior superior, elevates upper ribs, aids in inhalation. Serratus posterior inferior, depresses lower ribs, aids in exhalation. Deep, intrinsic back muscles. Erector spinae group. These muscles maintain posture and allow movement of the vertebral column. Iliocostalis, lateral column. Iliocostalis cervicis, extends and laterally flexes cervical spine. Iliocostalis thoracus, extends and laterally flexes thoracic spine. Iliocostalis lumborum, extends and laterally flexes lumbar spine. Longissimus, intermediate column. Longissimus capitis, extends and rotates the head. Longissimus cervicis, extends and laterally flexes cervical spine. Longissimus thoracis, extends and laterally flexes thoracic spine. Spinalis medial column. Spinalis capitis, extends the head. Spinalis cervicis, extends cervical spine. Spinalis thoracis, extends thoracic spine. Deep, intrinsic. Back muscles. Transversospinalis group. These muscles are smaller and help with fine motor control of the vertebral column. Semispinalis capitis, extends and rotates the head. Semispinalis cervicis, extends and rotates cervical spine. Semispinalis thoracis, extends and rotates thoracic spine. Multifidus cervicis, stabilizes cervical vertebrae. Multifidus thoracis, stabilizes thoracic vertebrae. Multifidus lumborum, stabilizes lumbar vertebrae. Rotatoris brevis, rotates vertebrae to opposite side, short fibers. Rotatoris longi, rotates vertebrae to opposite side, long fibers. Suboccipital muscles, near the base of the skull. These muscles fine-tune head movement. Rectus capitis posterior major, extends and rotates the head. Rectus capitis posterior minor, extends the head. Obliquus capitis superior, extends and laterally flexes the head. Obliquus capitis inferior, rotates the atlas and head to the same side. Segmental stabilizers of the spine, per vertebral level. These tiny muscles link one vertebra to the next, helping stabilize and control motion at each level. Interspinalis, connects spinous processes, aid in extension. Interspinalis, C1, extension at C1. Interspinalis C2, extension at C2. Interspinalis S5, deep extensor muscle of sacrum. Intertransversari, connect transverse processes, aid in lateral flexion. Intertransversari C1, lateral flexion at C1. Intertransversari C2, lateral flexion at C2. Intertransversari S9, deep lateral flexor of sacrum. Multifidus, segmental stabilizers. Multifidus C1, stabilizes vertebra C1. Multifidus C2, stabilizes vertebra C2. Multifidus S5, deep stabilizer at sacrum. Rotatories, segmental rotators. Rotatories C1, rotates vertebra C1. Rotatories C2, rotates vertebra C2. Rotatoris S5, deep rotator at sacrum. Additional important back structures. Thoracolumbar fascia, thick connective tissue that encloses and stabilizes the deep back muscles. Semispinalis capitis, lateral portion, provides lateral extension and rotation of the head. Semispinalis capitis, medial portion, provides medial extension and stabilization of the head. Spinalis thoracis, segmental extensor of thoracic spine. Longissimus lumborum, segmental extension of lumbar spine. Iliocostalis lumborum, segmental lateral flexor of the lumbar spine. Thank you for joining us today at Relax and Learn Medical, where learning anatomy becomes a soothing and immersive experience. The muscles of the back are not only powerful but beautifully coordinated to support posture, movement, breathing, and spinal health. By understanding these structures, from the massive trapezius to the tiny interspinales, we begin to appreciate just how intricately our bodies are designed. Listening to this while relaxing with 432 Hz frequency music helps you not only learn better, but also feel better. If you found this helpful, please like, share, and subscribe, and come back for more lessons that feed both your mind and spirit. Until next time, stay strong,